Good afternoon. This is All India Radio. I am Abhishek Mukhopadhyay and with me is Reshma Tiwari with the midday news. The headlines. Prime Minister Narendra Modi holds review meeting with ministers and senior officials in view of Cyclone Yas, directs to coordinate with states. Cyclone Yas likely to intensify into a very severe cyclonic storm to hit West Bengal and Odisha coast on Wednesday. India registers substantial decrease in total number of active cases. Recovery rate improves to 88.30%. More than 19 crore 15 lakh vaccine doses of COVID-19 administered so far. Over 2,40,000 COVID-19 cases reported in the last 24 hours. Delhi government extends lockdown till 31st of May. Centre holds high-level meeting to discuss CBSE Class 12 board examination and other upcoming entrance tests. 6 terrorists of Dimasa National Liberation Army gunned down in Karbi Anglong district of Assam. Indian Navy recovers mortal remains of 43 more crew members of barge P305. Their toll reaches 61 with 18 still missing. And Delhi police arrests Olympic medalist grappler Sushil Kumar in connection with the murder of a former junior. As the number of COVID cases is on the rise, we appeal to our listeners not to lower the guard, take all precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi has directed senior officers to work in close coordination with states to ensure safe evacuation of people from higher risk areas in view of Cyclone Yas, which is expected to cross West Bengal and North Odisha coast on Wednesday evening. Mr. Modi took a high-level meeting today to review the preparedness of states and central ministries and agencies concerned to deal with the situation arising out of Cyclone Yas. He also instructed all concerned departments to ensure timely evacuation of those involved in offshore activities. He spoke about the need to ensure that time duration of outages of power supply and communication network are minimum and are restored swiftly. The Prime Minister also asked officials to ensure proper coordination and planning with state governments to ensure no disruptions in COVID treatment and vaccination in hospitals. He also spoke about the need to involve district administrations in the process of planning and preparedness for better learning from best practices and seamless coordination. Mr. Modi directed officials that advisories and instructions on do's and don'ts during the cyclone be made available in easy to understand and local language to citizens of the affected districts. He spoke about the need to involve various stakeholders like coastal communities, industries, etc., but directly reaching out to them and sensitizing them. During the meeting, India Meteorological Department IMD informed that Cyclone Yas is expected to cross West Bengal and North Odisha coast by 26th of May evening with the wind speed ranging 155 to 165 km per hour, gusting to 185 km per hour. It is likely to cause heavy rainfall in the coastal districts of West Bengal and North Odisha. IMD has also warned of storm surge of about 2 to 4 meters in coastal areas of West Bengal and Odisha. IMD has been using regular bulletins with latest forecast to all the concerned states. The Prime Minister was informed that the Cabinet Secretary has taken a meeting of National Crisis Management Committee yesterday with Chief Secretaries of all coastal states and UTs and central ministries and agencies concerned. Home Ministry is reviewing the situation 24/7 and is in touch with the state governments and UTs and the central agencies concerned. It has already released first installment of SDRF in advance to all states. NDRF has pre-positioned 46 teams which are equipped with boats, tree cutters, telecom equipment, etc. in 5 states and UT. In addition, 13 teams have been airlifted today for deployment and has kept 10 teams on standby. Indian Coast Guard and the Navy have deployed ships and helicopters for relief, search and rescue operations. Air Force and Engineer Task Force units of Army with boats and rescue equipment are on standby for deployment. 7 ships with humanitarian assistance and disaster relief units are on standby along the western coast. Ministry of Petroleum and Natural Gas has taken measures to secure all oil installations in the sea and to bring back the shipping vessels to safe harbour. Ministry of Power has activated emergency response systems and is keeping in readiness transformers, DG sets and equipments, etc. for immediate restoration of electricity. Health Ministry has issued advisory to the states and UTs likely to be affected for health sector preparedness and response on COVID in affected areas. The meeting was attended by Home Minister Amit Shah, Principal Secretary to Prime Minister, Minister of State for Home, Cabinet Secretary, Secretaries of Ministries and Departments of Home, Telecommunications, Fisheries, Civil Aviation, Power, Ports, Shipping and Waterways, Earth Sciences, Chairman Railway Board, Members and Member Secretary of NDMA, DGs of IMD and NDRF, and Senior Officers of PMO and Home Ministry.
Cyclone Yas is likely to intensify into a very severe cyclonic storm and cross the Odisha and the West Bengal coasts on Wednesday. India Meteorological Department IMD said a low-pressure area has formed over the east-central Bay of Bengal and the adjoining North Andaman Sea yesterday. It is likely to cross West Bengal and adjoining North Odisha and Bangladesh coasts around the evening of the 26th May. Director IMD Bhubaneswar, H.R. Biswas, said that north coastal Odisha is likely to witness light to moderate rainfall from Tuesday.
रेनफॉल नॉर्थ कोस्टल उड़ीसा में 25 में होने का चांसेस है, लाइट टू मॉडरेट. साउथ कोस्टल उड़ीसा में मेनी प्लेसेस में होगा. नॉर्थ इंटीरियर में भी मेनी प्लेसेस में, साउथ इंटीरियर में फ्यू प्लेसेस में होने का चांसेस है. हेवी टू वेरी हेवी रेनफॉल नॉर्थ कोस्टल का सभी डिस्ट्रिक्ट, साउथ कोस्टल का पूरी खोर्धा और इंटीरियर का मयूरभंज, ऐसा भद्रक, जाजपुर, केंद्रापड़ा, जगतसिंहपुर, बालासोर, कटक, पुरी, खोर्धा, मयूरभंज, ऐसा डिस्ट्रिक्ट में हेवी टू वेरी हेवी रेनफॉल होने का चांसेस है.
Our Bhubaneswar correspondent reports that all the coastal districts in North Odisha have been put on high alert and are ready with cyclone shelters.
Basing on the inputs of the Indian Meteorological Department on the probable cyclonic trajectory crossing the North Odisha West Bengal coast on the 26th of this month, all the coastal districts in North Odisha have been put on high alert and are ready with cyclone shelters with adequate provisions of food, medicines and drinking water. While more than 3,000 such cyclone shelters have been readied for the evacuees, NDRF, ODRAF and firefighting teams are also being positioned in those districts likely to be affected by the probable cyclone. Meanwhile, Chief Minister Naveen Patnaik has directed officials to ensure that no life is lost and the supply chain of medical oxygen, both within and outside the state, is not snapped. Girish Chandradas, AIR News, Bhubaneswar.
Indian naval ships and aircraft are on standby for rescue and relief operations in view of Cyclone Yas. Defence Ministry said Indian Navy is closely monitoring the movement of the cyclonic storm. Headquarters of Eastern Naval Command and naval officers in charge at West Bengal and Odisha area have carried out preparatory activities to combat the effects of Cyclone Yas. As part of the preparedness, 8 flood relief teams and 4 diving teams are pre-positioned in Odisha and West Bengal to augment the existing resources. 4 naval ships are on standby with humanitarian assistance and disaster relief HADR bricks, diving and medical teams to render assistance in the most affected areas along the Odisha and West Bengal coast. Naval aircraft are kept ready at naval air stations to undertake an aerial survey of the most affected areas, casualty evacuation and airdrop of relief material as required.
Bangladesh is bracing to face the cyclone Yas, which is likely to hit its coast on Wednesday. The State Minister for Disaster Management and Relief, Inamur Rahman, told media that the government is preparing cyclone shelter with 3 times more capacity in view of the COVID-19 situation in the country to accommodate people during the cyclone. The minister said that the possibility of the cyclone hitting the coast of Bangladesh will be clear today, but concerned persons have been asked to make preparations on time. The Bangladesh Meteorological Department has asked the maritime ports of Chattogram, Cox's Bazar, Mongla and Paira to hoist the distant cautionary signal 1. It also advised the fishermen not to venture into the deep sea, and those already in the deep sea have been advised to return to the coast. Nation continues to march strongly on its path of COVID recovery with substantial increase in total number of active cases. For the 10th consecutive day today, the number of patients discharged has outnumbered the number of new cases. In the past 24 hours, over 3,55,000 COVID patients successfully recovered from the disease, whereas in the same time span, 2,40,842 fresh cases were recorded nationwide. With this, the recovery rate in the country has further improved to 88.30%. The cumulative share of the active COVID cases in the country also continues to witness consistent decline and comprises nearly 10.57% of the total reported cases. Currently, over 28 lakh people are reported to be suffering from the viral pandemic and are either hospitalized or are under home isolation. 10 states including Maharashtra, Karnataka, Chhattisgarh, Delhi, Tamil Nadu, Uttar Pradesh, Punjab, Madhya Pradesh, Gujarat and Kerala continue to be the major hotspots of the viral pandemic. Nearly 78% of the new cases are reported from these 10 states. The Health Ministry has informed that 3,741 COVID-related deaths were reported in the last 24 hours, taking the cumulative toll to 2,99,266. ICMR is informed that in the past 24 hours, another milestone in terms of daily testing was achieved, with more than 21,23,000 samples being tested across the country.
India achieved another milestone in its COVID-19 vaccination drive as the cumulative number of doses administered in the country crossed 19 crore 50 lakh mark. Union Health Ministry has informed that so far around 1 crore beneficiaries in the age group of 18 to 44 years have been given the first dose of the vaccine. The ministry said in the last 24 hours of the largest vaccination program in the world, over 16 lakh doses of COVID-19 were administered, taking the cumulative figure to over 19 crore 50 lakh. Nearly 6,82,000 people in the age group of 18 to 44 years received their first jab in the past 24 hours. The centre is continuously reviewing and monitoring the vaccination program at the highest level as a tool to protect from COVID-19, the most vulnerable population groups in the country. Delhi Chief Minister Arvind Kejriwal today announced extension of lockdown in Delhi till 5 a.m. on May the 31st. He said the situation against coronavirus is getting better with the efforts of the people and all should remain disciplined in the same way. Mr. Kejriwal said there is no oxygen crisis in Delhi now. He said COVID-19 cases continue to decrease in the city. The Chief Minister expressed relief that the positivity rate has come down to 2.5% in Delhi. Our correspondent reports Delhi Police has launched Corona Rakshak initiative to inspire citizens to wear masks and follow all COVID norms.
Reporting a decline in cases for the third consecutive day, Maharashtra added 26,133 new cases on Saturday, lowest in 2 months. With this, the state reported daily possibility rate 9.2%. However, the fatalities continued to be high as 682 deaths were added, taking a cumulative toll to 87,300. With Saturday's addition, the state total caseload rose to 55.5 lakh. Nagaland yesterday detected 252 fresh COVID-19 infections, increasing the tally in the state to 19,854. The state also had recovery of 214 positive patients, adding the number of recovered persons to 14,363. On the other hand, 13 COVID-related deaths were also reported, taking the COVID death toll to 260. The number of active cases in the state stand at 4,607 active patients.
Deputy Chief Minister Dr. C.N. Ashwath Narayan distributed ration kits to the artists working in the Kannada film industry. Speaking during the event today, the minister said that the Kannada film industry is suffering due to the pandemic situation. He said since March 2020, there is no shooting and screening of films, leading to financial crunch among those working in the film industry. Along with ration kits, a check of 1,000 rupees was also handed over to the artists in Bengaluru today. Dr. Narayana has assured that the government will extend all possible help to the artists who, he added, contribute to the enrichment of our history, culture and language. He said arrangements will be made to vaccinate the film industry artists on priority basis. As the posts of the innovative activities of Shramjeevi COVID Care Center at Usgaon Dongri in Palghar district of Navi Mumbai are going viral, various people are extending a helping hand to provide relief to the patients. After seeing some similar posts on his father's mobile, a 14-year-old Parth Ramakant Patil, a 9th grader, rushed to his aid. More from our Mumbai correspondent.
As the post of the innovative activities of Shramjeevi COVID Center of Palghar are going viral, a 14-year-old Parth Ramakant Patil withdrawn money from his piggy bank and purchased a wheelchair worth Rs 6,500. He gifted it to the Shramjeevi COVID Center in Palghar. Speaking with our correspondent, Parth said, I purchased a wheelchair with my father and gifted it to the Shramjeevi COVID Center. Bhavna Gokhale, AIR News, Mumbai.
In Karnataka, acute shortage of hospital beds for the COVID-19 patients has made it essential to create additional beds to cater to the growing list of patients. In this hour of need, the Indian Army has come forward to set up a 100-bed COVID care center in Bengaluru. More from a Bengaluru correspondent.
To augment the medical infrastructure of state administration, the Indian Army has set up the new COVID care center in Alsuru in the city in collaboration with the civil administration. The medical staff and equipment for the center will be provided by the State Health Department, and the Army will shoulder administrative support for the maintenance of the high standard facility. The center will cater to mild symptomatic and asymptomatic COVID patients referred by Bruhat Bengaluru Mahanagara Palike through its bed allotment system. The General Officer Commanding of Karnataka and Kerala Area, Major General J.V. Prasad has assured the state that Army will stand by its resolution of keeping the citizens safe and extend help in reducing the suffering of Bengaluru residents. Sudhindra, AIR News, Bengaluru.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi holds review meeting with ministers and senior officials in view of Cyclone Yas. This directs to coordinate with states. Cyclone Yas likely to intensify into very severe cyclonic storm to hit West Bengal and Odisha coast on Wednesday. India registers substantial decrease in total number of active cases. Recovery rate improves to 88.30%. More than 19 crore 50 lakh vaccine doses of COVID-19 administered so far. Over 2,40,000 COVID-19 cases reported in the last 24 hours. Delhi government extends lockdown till 31st May. Centre holds high-level meeting to discuss CBSE Class 12 board examination and other upcoming entrance tests. 6 terrorists of the Masa National Liberation Army gunned down in Karbi Anglang district of Assam. Indian Navy recovers mortal remains of 43 more crew members of barge P305. Death toll reaches 61 with 18 still missing. Delhi police arrests Olympic medalist grappler Sushil Kumar in connection with the murder of a former junior. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts. चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे. Welcome back. You're listening to the Midday News. All India Radio News has been at the forefront on raising awareness on COVID-19 among the citizens since the first coronavirus case was reported in India. In keeping with its role as the public service broadcaster, News Services Division of All India Radio started a special public outreach program, Corona Jagrukta series, in March last year. Today, this program completes its 400th episode. It is a live phone-in program in which top medical experts answer to COVID-19 related queries of citizens. Renowned doctors from AIIMS Delhi, GB Pant Hospital, RML Hospital, Sadrajang Hospital, King Edward Memorial Hospital Mumbai, AIIMS Bhopal, Patna, Rishikesh, Nimhans Bangalore, King George's Medical University Lucknow, Savai Man Singh Hospital Jaipur and other famous medical hospitals participated in the program and responded to various queries from citizens. The program played a crucial role in generating awareness on COVID infection during lockdown and on the COVID-appropriate behavior in the unlock phase. Now, during the second wave, it is playing an important role in dispelling the fears on safety and efficacy of the vaccines and allaying the doubts related to COVID-19 and black fungus, white fungus infections. In the 400th special episode tonight, Professor Medicine, Lady Hardinge Medical College, Dr. Madhur Yadav will be with us to address the queries. This can be heard on FM Gold channel and additional frequencies from 9:30 p.m. onwards. Listeners can ask questions to the expert on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on a Twitter handle @AIR News Alerts by hashtag AskAIR. Professor Nikhil Tendon, head of the Department of the Endocrinology at AIIMS New Delhi, participated in a special program on COVID-19 last night, said that mucormycosis, commonly known as black fungus, usually affects COVID patients with low immunity.
म्यूकरमाइकोसिस का ब्लैक फंगस फफूंदी है एक किस्म की. इसका रंग काला नहीं होता है, लेकिन इसकी वजह से जो शरीर की कोशिकाएं हैं, शरीर की टिश्यूज हैं, उनमें डैमेज होने की वजह से उन टिश्यूज की मृत्यु हो जाती है, तो वो काला रंग पकड़ लेती है, इसलिए इसे ब्लैक फंगस कहते हैं। इस लहर में कोरोना के पेशेंट्स के साथ हुआ है, लेकिन ये वाला जो फंगस इन्फेक्शन है ये पहले से होता रहा है। जिस इंसान की इम्यूनिटी ठीक होती है वे वैसे स्वस्थ होते हैं, अगर ये उनके शरीर में आता भी है तो शरीर उसको निबट देता है। जो कोविड से पीड़ित नहीं हुए हैं और वैसे स्वस्थ हैं उनमें ये नहीं होगा।
Replying to the question, Dr. Tandon said that hospitalization is important for people suffering from black fungus.
म्यूकर माइकोसिस वैसे तो बहुत अनकॉमन बीमारी है, लेकिन ये बीमारी अगर हो जाती है तो ये गंभीर हो जाती है। इसलिए शुरुआत के दिनों में तो डेफिनेटली अस्पताल में भर्ती होना ही उचित होगा, क्योंकि लोगों में ऑपरेशन करके जो नाक में और साइनसेस में टिश्यूज से फंगस का लोड हटाना पड़ेगा, तो उसके लिए एक ऑपरेशन चाहिए होता है। उसके बाद नसों में दवाई दी जाती है और इन दवाइयों के भी अपने कॉम्प्लिकेशंस हो सकते हैं, तो उन पे ध्यान रखना पड़ता है। तो अस्पताल में भर्ती होके ही शुरुआत में, जब तक स्थिति संभल ना जाए और हमें मन में ये ना हो जाए कि जो मेन कार्य है वो खत्म ना हो गया, तब तक तो जरूर ही अस्पताल में भर्ती होना चाहिए।
In an exclusive interview to AIR News in the Surkhiyon Mein program, Maharashtra's Nandurbar District Collector Dr. Rajendra Bharur said advanced preparedness for oxygen supply arrangements in his district ahead of the second wave of pandemic helped the district to overcome medical oxygen demand during the difficult times. In this interview, the collector also shared how the district administration converted schools and community halls into COVID-19 centers and created a website to help control the panic and guide the citizens.
तो हमने कोई भी गवर्नमेंट हॉस्पिटल को कोविड में कन्वर्ट न करते हुए नए सिरे से उसका प्लानिंग शुरू किया। सबसे पहले हमने 20 बेड से शुरू किया और वो जर्नी आज हॉस्पिटल के लगभग 1400 बेड के ऊपर हमारा चला गया है। उसके अंदर गवर्नमेंट का भी सेटअप है, प्राइवेट का भी सेटअप है। आज के समय में ऑक्सीजन प्लांट्स हो, एम्बुलेंसेस हो, बेड्स हो, आइसोलेशन के जो बेड्स है उसके 7000 के ऊपर बेड्स है और गवर्नमेंट के 3 प्लांट है ऑक्सीजन के, प्राइवेट के 3 प्लांट है, तो 6 पीएसए प्लांट काम कर रहे हैं। 20,000 लीटर का एक ऑक्सीजन बड़ा टैंक लगाया गया है।
To listen to the full interview, tune into FM Gold channel and additional frequencies today from 7:40 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. The Ministry of Ayush is organizing various activities in the run-up to the International Day of Yoga 2021. One among these is a series of 5 webinars that the ministry is organizing under the broad theme of Be with Yoga, Be at Home. It is being organized in collaboration with 5 renowned organizations of the country who will present one webinar each on a particular topic of importance in the current scenario. The ministry in a statement said that the first among the series will be held tomorrow by the Art of Living on finding inner strength amidst outer crisis.
The Centre today convened a high-level meeting to discuss CBSE Class 12 board exams and other upcoming entrance tests. The meeting has been chaired by Defence Minister Rajnath Singh. It is attended by Union Ministers Ramesh Pokhriyal Nishank, Smriti Irani and Prakash Javadekar, among others. Education Minister Nishank said that Prime Minister Narendra Modi desires that any decision affecting the career of students has to be taken in consultation with all the state governments and stakeholders. Mr. Nishank has recently held a meeting with the state education secretaries in this regard. He has also sought suggestions from people through Twitter. In Chhattisgarh, the State Board of Secondary Education has released the timetable and guidelines for the 12th board examination. In view of the COVID situation, it has been decided that the exam will be in offline mode, but the students will be allowed to write answer sheets at home. More from a correspondent.
Students would take the question paper and answer sheet to their home, write the exam and can return the answer sheet at the center within 5 days. The distribution of question papers and answer sheets will take place from 1st to 5th of June. Students must present themselves to collect these materials. The answer sheets will have to be submitted by the candidate himself. The student will be considered absent for not submitting the answer sheets on the stipulated time limit. While obtaining the question papers and answer sheets from the examination center and submitting them, it will be mandatory for the students to follow the COVID protocol. Vikalp Shukla, AIR News, Raipur.
On the 7th day of its search and rescue operation off Mumbai coast, Indian Navy today recovered the mortal remains of 43 more crew members of the ill-fated barge P305 that went adrift following Cyclone Tauktae on Monday. Subsequently, the death toll has risen to 61 while 18 people are still missing. INS Beas, INS Kochi, Kolkata, Betwa, Talwar, Teg, P-81 maritime surveillance aircraft, Chetak, ALH and Sea King helicopters are involved in the search and rescue operations. In Assam, 6 Dimasa National Liberation Army DNLA terrorists were gunned down in an exchange of fire at Karbi Anglong district during the wee hours today. More from our correspondent.
Karbi Anglong District Superintendent of Police Pushparaj Singh said that search operation is still on at Dhansiri area in the Assam-Nagaland border. He said so far bodies of 6 militants of Dimasa National Liberation Army have been recovered. After a long interval, security forces had to launch such a massive operation in Assam against any militant outfit. The group was involved in the killing of a civilian at Dhansiri on 19th of this month. The joint team of Assam Rifles and police launched an operation against the outfit, and after heavy exchange of fire, security forces gunned down the militants. Large number of arms and ammunition have also been recovered from the spot. Manas Pratim Sharma, AR News, Guwahati.
Delhi police today arrested Olympic medalist Sushil Kumar in connection with the murder of a 23-year-old former junior national wrestling champion Sagar Dhankad. Kumar had been on the run since May 5th when an FIR was registered against him at Model Town Police Station. On May 4th, Dhankad, who had competed in the 97-kilogram Greco-Roman category, was beaten to death following a clash between two groups. A Delhi court on May 18th had rejected the anticipatory bail filed by Sushil Kumar. The court observed that the allegations against the champion wrestler were serious. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in the Mann Ki Baat program on All India Radio on the 30th of this month. It will be the 77th episode of the monthly radio program. People can share their views in the Namo app or MyGov Open Forum. They can also dial the toll-free number 1800 7800 and record the message for the Prime Minister in either Hindi or English. People can also give a missed call on 1922 and follow the link received in SMS to directly give their suggestions to the Prime Minister. Now let us take a look at the weather forecast for the day. The national capital Delhi may witness strong surface winds. Mumbai has partly cloudy sky. Minimum temperature is 27 degrees Celsius, while the maximum is expected at 34 degrees. Chennai is having generally cloudy sky with light rain or drizzle. The temperature varies between 27 and 34 degrees Celsius. Kolkata is mainly clear sky. Minimum temperature is 29 degrees Celsius and the maximum may go up to 38 degrees. Jammu is having partly cloudy sky, becoming generally cloudy towards evening or night. Minimum temperature was 22 degrees Celsius, while the maximum will be around 36 degrees. Srinagar has generally cloudy sky with light rain. The temperature hovers between 12 and 20 degrees Celsius. Leh is having partly cloudy sky with minimum and maximum temperature hovering between 3 and 18 degrees Celsius. Gilgit has generally cloudy sky. The temperature is hovering between 11 and 25 degrees Celsius. Muzaffarabad is witnessing thunderstorm with rain. Minimum temperature was 17 degrees Celsius and the maximum will be around 30 degrees. Dehradun has mainly clear sky. Minimum temperature was 21 degrees Celsius while the maximum will be around 35 degrees. Chandigarh has partly cloudy sky. Minimum temperature was 29 degrees and the maximum will be 39 degrees Celsius. In Hyderabad, the rain or thunder showers will occur towards evening or night. Patna is having mainly clear sky and Guwahati has partly cloudy sky. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi holds review meeting with ministers and senior officials in view of Cyclone Yas, directs to coordinate with states. Cyclone Yas likely to intensify into a very severe cyclonic storm to hit West Bengal and Odisha coast on Wednesday. India registers substantial decrease in total number of active cases. Recovery rate improves to 88.30%. More than 19 crore 50 lakh vaccine doses of COVID-19 administered so far. Over 2,40,000 COVID-19 cases reported in the last 24 hours. Delhi government extends lockdown till 31st of May. Centre holds high-level meeting to discuss CBSE Class 12 board examination and other upcoming entrance tests. 6 terrorists of Dimasa National Liberation Army gunned down in Karbi Anglong district of Assam. Indian Navy recovers mortal remains of 43 more crew members of barge P305. Their toll reaches 61 with 18 still missing. And Delhi police arrest Olympic medalist grappler Sushil Kumar in connection with the murder of a former junior. And with that we end the midday news.